Thanks very much, Kathy. Thank you for your introduction. Just before we start, I just want to introduce myself. My name is Niall Gallagher. I'm a social worker in the specialist palliative care team in the Southern Trust. I commenced the role in last November. My predecessor, Deirdre McKenna, so a hard act to follow. I just want to say thank you to the All Ireland Institute of Hospice and Palliative Care for hosting this event for Palliative Care Week 2020. It's a privilege to speak at such an event. I suppose this session today really is aimed at our district nursing colleagues, especially in the Southern Trust in Northern Ireland. The session really is an awareness raising on advanced care planning. And certainly the hope is that it provides district nursing with some maybe extra knowledge. I know some district nurses are very experienced and would have done this before. I know there's some new people that are starting and want to learn. So it's for everybody really, and maybe provide a platform to seek further information on the topic. As I said today, it's only really a half an hour maybe. So it's going to be very sort of basic, but hopefully it explains. And also just want to welcome others who have joined who are not from district nursing and who are just here to learn and listen. So to start off with, Kathy, going to go to the next one? Okay. So basically, why advanced care planning is important for district nursing. The regional strategy within Northern Ireland for palliative care, basically it's divided up into some parts. The first part would be identifying who requires palliative care. Okay, so once we establish that, then the next part of the strategy is to identify a key worker. Most of the time, the key worker in palliative care will be a district nurse, but it doesn't have to be a district nurse, as the district nurse will be working closely with the person and their family. And also a big part of the key role, or the role that a key worker has to play, would be to undertake advanced care planning. It's important as well, advanced care planning, especially now with the current climate, with COVID-19. We know that people have been frightened. There's a heightened sense of people's mortality. So advanced care planning, it's an important process to discuss with our clients. Okay, and also because the population of Northern Ireland is getting older, the mortality rate's going to increase, and again, advanced care planning has an important role to play. Could I go to the next one, Kathy? So in Northern Ireland, we use this document. It's freely available. It was produced by Macmillan and the Palliative Care Partnership. And really it contains the information on advanced care planning. It contains forms at the back of the booklet called Record of My Wishes, and a form called My Advanced Decision to Refuse Treatment, and also a checklist. So basically, if you can get your hands on this book and have a read at it, it has important information. It's also widely available to the public. You can get it in libraries. Pharmacists have lots of copies. I think like last year there were 17,000 copies sent out. So this is the document that we try to use regionally, and the forms that would be in the back for the forms that we would use. Okay, next. So just a definition of what advanced care planning is. So advanced care planning is the term used to describe a conversation between people, their families and carers, and those looking after them about their future wishes and priorities for care. So it's important to mention that it's future wishes and priorities for care. Advanced care planning is key means of improving care for people nearing the end of life and enabling better planning and provision of care to help them live well and die well in the place and the manner of their choosing. It enables people to discuss and record their future health and care wishes, and also to appoint someone as an advocate or surrogate, thus making the likelihood of these wishes being known and respected at the end of life. The main goal is to clarify people's wishes, needs and preferences and deliver care to meet these needs. People may need support to make advanced care plans. This support could come from family, friends, care staff or doctors. So advanced care planning, it's important to point out at this point that it's voluntary. You know, people don't have to do it. People choose not to do it. But as a healthcare professional, it's important that we make people aware that it's there, and it can instigate conversations. Next. So an advanced care plan continued. There's within the booklet that I've just shown, there are two parts to an advanced care plan. There's the personal part and there's also a clinical part. The personal part, really that's a record of the person's wishes, and recognizing what there may be cultural beliefs, the religious beliefs, who's important to them, the power of attorney, wills, funerals, all those type of things that matter to people. And I suppose that's really important for people to record, and I'll go into that a wee bit further, why it's so important. There's also the clinical part of the advanced care plan, and that can suggest where people, maybe the place of care for their end of life. The majority of people that I've spoke to have indicated their wish to remain at home. Some people want to go to hospital. Some people want to go to hospice for different reasons. So, and again, as this mentions, there are certain forms that people can record their wishes, and they're freely available. And there's also a form, an advanced care summary, which is on the Trust SharePoint. It's important to point that out. Within the Southern Trust palliative care, SharePoint has a lot of information on these forms can be downloaded. Next. Okay. So as a district nurse, when you're seeing people, I suppose one of the things would be when should you maybe have this conversation? And I suppose it's about building a relationship with the person first of all, getting to know them. District nurses are ideally placed. They're going into people's homes. They know the family dynamic. They're building up relationships with people. They know what they want. They can get into those conversations. Maybe not sometimes, but a lot of times, yes. So NICE and their guidelines recommended that advanced care planning should start as early as possible after a diagnosis of any life-limiting condition. And that's really to enable people to make informed choices about their future care. And it's particularly relevant at a time of crisis, such as COVID-19, when individuals may be receiving news of diagnosis which may or may not be life-limiting. The guidance is clear that support and advice should be given at the most suitable time following any diagnosis, then repeatedly throughout the illness, to allow people to think through and address different issues in their own time. To make advanced care planning as useful and meaningful for the individual. And I suppose in respect of some conditions, which would be maybe dementia, a person who's been recently diagnosed with dementia, obviously as time goes on, the ability to make those decisions may become more difficult, and it's good then maybe to start that conversation or providing information about advanced care planning so people know that they may want to prepare for when they're not able to make those decisions. Next. Okay. So when we're introducing advanced care planning, I suppose it's a simple skill, but being sensitive is probably one of the most important things. Advanced care planning, it's not a tick box exercise. It's not seeing somebody on their first, second visit and suddenly going into a conversation about advanced care planning. It's about being sensitive, picking up the cues from people. People may want to initiate it with you. You know, family may have spoken to them, may have had those discussions, they may want advice on what to do. And again, it's important to be sensitive that some people don't want to talk about advanced care planning, and we must respect that. It is a voluntary process. And it's also important to check if the person already has an advanced care plan in place as well. Remember, everybody's different. Their wish for knowledge, autonomy and control, that'll vary. We've all met people who like to write things down and get things done, organized really quickly. Other people would just like to talk about things and maybe not write things down, and that's okay. But I suppose by having this knowledge of advanced care planning is just be ready at any time to explain the purpose of advanced care planning and discuss the advantages of it. And it's also important to remember that some people may make choices that might seem unwise to you. That doesn't mean they're unable to make decisions or their decisions are wrong. So we must respect that. This is important. But it's our job to explain the benefits of advanced care planning. Research has shown that advanced care planning can give peace of mind to people and their families. I recently watched a clip on YouTube where somebody has described advanced care planning as an act of love, having everything sorted so that the family can grieve without having to go looking for different things when everything has been prepared. I suppose some of the barriers maybe to initiating an advanced care plan would be that we're afraid of the person losing hope, or because we've been given them maybe an unfavourable picture of their future health. But it's important to know that many chronically ill people and their family members are already thinking about future healthcare decisions and would be willing to engage in a conversation if initiated. So again, you know the person, and you can judge it on your visits. Next. Okay. So some of the triggers for initiating, so if you're not sure, these are things that you could maybe look out for. Obviously, the first one would be where a person would initiate the conversation. They may have built sufficient trust within you to talk to you about this. And it's important to know that the person will pick you out. There may also be other healthcare professionals or family or friends that they'll do this with as well. But as this is aimed at district nursing, where media topics may prompt conversation. Again, COVID. There's been a lot of worry and concerns and anxiety. Watching the news, social media. There's been a big uptake in people making their wills. So, I mean, this is obviously something that can initiate the conversation. A diagnosis of a progressive life-limiting illness. Again, that's something that people, it brings it home to them. They're faced maybe with their mortality, whereas maybe they hadn't thought about it before. A diagnosis of a condition with a predictable trajectory, which is likely to result in a loss of capacity. That for example, dementia or motor neuron disease, or mental health, mental illness. A change in deterioration of condition, multiple hospital admissions where the person's maybe gradually their condition is deteriorating, and they may think that it's time maybe to start planning. There may be a change in a person's circumstances, such as moving into a care home or hospice. Could be a loss of a family member where a person's beginning to think to plan for the future. Another one where treatment is no longer an option, where a person has been told that treatment that their condition isn't curative, and the palliative care is their best option. Okay, next. As a district nurse, you're in an ideal position to provide information. People may ask about their condition. Lots of times where a person maybe has been given a diagnosis and hospital hasn't retained the information. They may be in shock. And as a key worker, you're in an ideal position to provide this information, to talk to them about it. And it's about being honest with people. Advanced care planning isn't about promises, and we're not promising people things. Where people are making their wishes and their feelings clear, and you're working with those people to try and ensure that that's the outcome that they want. And it's explaining it in a way that they understand. Sometimes there can be a lot of medical jargon. It's keeping things simple so that people can understand. If someone has recently been diagnosed with a long-term or life-limiting condition that may affect their ability to make decisions in the future, make sure they have that information. So talk to them about advanced care planning. Tell them what it is. And again, we do have that booklet. Have the conversation with the person what it is, and then maybe provide them with the booklet. Leave it with them. Ask them to look through it, and come back and on your next visit or two, say, did you have a wee look at that book? What did you think? Those type of things. And also, I suppose it's important. People will be worried about losing capacity for certain conditions. It's about talking to them about that, what happens, and that's why advanced care planning is important, to give people that security and peace of mind, that somebody knows what their wishes and their feelings are. It's important that they know that we know. And also, sorry, I missed out there, how they can change decisions they've made while they have capacity to do so. Advanced care planning is an ongoing process, so we can revisit it at any time. It can be changed, and that's reassuring for people as well. Next. So some of the benefits of advanced care planning, you wonder why you're doing this. So it's more likely that other people understand what's important to you by making your wishes clear. It makes it more likely that you get the care that you want, and people will work towards those goals if they know what they are. And it also makes things easier for your family. For example, where people haven't made plans and they're suddenly admitted to hospital where they're unconscious, and families are having to make decisions in a time of crisis, and it can cause a lot of anxiety and stress. So that's what one of the benefits of it. And even if you're not approaching end of life, it can still be helpful to plan ahead. So it's helpful if there's a time in the future where you aren't able to tell people what you want. Basically, what we're doing is it's person-centered. when we're working from the person's perspective, we're providing them with its dignity. They're making the choice here. We're empowering people. We're enabling them to make decisions. We're respecting their decisions. And ultimately, it gives the person a sense of control. They're in control of the situation, and we're there to guide them and help them as best we can. Next. So, if you're in the position where you're helping people to decide, to make an informed choice, it's important that it's entirely their decision. An advanced care plan can cover areas as the person's thoughts and the different types of care, support or treatment, financial matters. So somebody may want to have their finances in order. They may want to take out an enduring power of attorney, where somebody can look after their affairs if they don't have the capacity to do so. And it's how they like to do things. It could be things like I've wrote in there, for example, shower rather than bath, those type of things. So it's again making sure that you are fully informed with the person's medical condition and treatment options, to help the process and involve the relevant healthcare staff if needed. So it's not about asking about the end of life to the people. It's about asking what matters in their life now. And you know, we'll come to the point where it is about end of life, but it's what matters now to the person. Okay, next. Some of the challenges for health professionals in general in producing advanced care plans, and especially district nursing as well. We know that district nurses are lots of visits, and you know, time is precious when you're having to see a lot of people during the day. So capacity was certainly one of the challenges. Advanced care planning, it does take time. We can't rush it. It's not a tick box exercise. Another challenge would be that the person isn't fully aware of their diagnosis. And again, you can imagine how difficult it would be then to introduce the concept of advanced care planning if they're not fully aware. So that may be something that you could that you may want to take forward, or maybe a GP, or maybe family or friends. There's also cultural sensitivities, so we need to be aware of that when we're entering people's homes. End of life cares, there are different there are differences within cultures around that. Oppression, many people have suffered oppression in their lives, and it's important to be aware of that as well when discussing sensitive subjects. A loved one may be upset, so family may be angry, upset that this is been talked about. So again, it's being sensitive and knowing where we are in that conversation, and it's just been mindful of that fact. Our resources were already mentioned, time constraints, and again, one of the big things is we don't want to upset or diminish hope, and that's natural within people, especially in a caring profession. We don't want to upset people, but it's important as well that we're open and honest. You know, if we go back to our code ethics, you know, being honest and upfront is right at the top there. And again, you know, when we are upfront with people, then that gives them control. They're empowered by that. And again, it's doing it sensitively and taking time and knowing where a person's at. And again, it's recognizing that not everybody will want to do an advanced care plan, but as health professions, we should maybe provide information, tell them that it's there. If a person doesn't want it, just record it in your notes, or you may revisit it another time when a person's ready. It depends. And even if a person isn't deemed to have capacity, attempts should be made to involve them if possible, and that's important too. Okay, next. So developing an advanced care plan. So ask the person if they want to involve their family, friends, or advocates, and if so, make sure that they're included. Help them to consider whether involving a healthcare professional could be useful. And again, I've sort of touched on some of this. Take into account the person's history, their social circumstances, wishes and feelings. Again, I've mentioned the cultural, ethnic factors, their aspirations, and any other factors they feel are important. Help them think about how their needs might change in the future as well. So it does take time. Okay, next. Okay, so a really important thing with advanced care planning is choosing the right time to do it. And again, our experience and our knowledge and working with the family, we should have built up skills and knowledge to maybe recognize that. So one of the things is that a person should be in a comfortable and a stable condition so that they're not in pain or they don't want to rush things. I mean, we know people who have been diagnosed and have come home and have done everything really quickly, and that's okay. But it's important that the process isn't rushed. It's important that the person has capacity. Always assume the person has capacity unless it's proven that they don't. As a district nurse, again, the advantage of seeing people in their homes can mean that the person is more relaxed in this environment. So people are, when a person goes into hospital, their expectations on their anxiety are different. It can be initiated in any setting. It can be carried out by any healthcare worker. It takes time and it's ongoing, and also be prepared for emotions. These are difficult conversations that people are having, and take time with that person. Recognize that the emotions they're going through are natural. Some people will never do one, and again, as I've said, record that it has been offered. Again, another thing is the time of day. So a person may not get up to 1, 2 o'clock. Person might be up early, maybe feeling less tired as the day goes by. So it's picking those moments and knowing when the best time of the day is. Okay. Next, sorry. Okay, so some of the skills that we're using anyways, it's just to highlight these. Communication skills, obviously, non-verbal, verbal. Being sensitive, which I've already mentioned. These are difficult conversations and it can't be rushed. Being open and honest. Listening skills. It's important that you're listening, actively listening, that the person knows that you're engaged and knows that they're being listened to, because that's so important. Relationship building, again. Building rapport, developing a rapport with that person and the family, but before we can get into these discussions and knowing when you can and when you can't do it. Providing information that it's person-centered, that the person is the focus. They're the person that we are helping. They're in the center, so everything else is around them, and we're trying to work and help them and be an advocate. And consent is vitally important as well. That we gain the person's consent, and again, capacity would come in there as well. Okay. Next. So you may need help with communication, and again, I've mentioned a few of these briefly. So the person may need help to communicate during these discussions, so you may need to include communication aids. You may need an independent advocate, interpreters, specialist speech and language therapy support, or you may need to involve families and friends. So again, you know, that can be time, that might take time to do all these things, but it is so important. Okay, next. Okay, recording and sharing advanced care plans. So ask if the person consents for their plan to be shared with the relevant people. If they consent, ensure the plan is shared and transfer the plan if their care provider changes. You can review the care plan whenever treatment or support is being reviewed while the person has capacity. And you the person may want to make changes. If the person is nearing the end of life, ask if they would like to review their plan or develop one if they haven't already. Advanced care plans are transferable in Northern Ireland. So if it has been started in a hospital, it can be transferred to community hospice settings, nursing home. Advanced care plan and advanced statements are not legal documents, but they're taken into account when it's needed. Okay, next. Okay, so part of the clinical part of an advanced care plan is the advanced decision to refuse treatment. So it's a decision to refuse a specific type of treatment, and the word specific there is very important. So an advanced decision to refuse treatment will only be used if you lose the ability to make your own decisions about your treatment. So that's really important. Okay. And it's important to say that the advanced decision to refuse treatment is legally binding under common law when it meets certain conditions. Okay, next. Okay, in an advanced decision to refuse treatment, you can state the specific treatments you wish to refuse, and state in what circumstances your refusal will apply. You can refuse treatment that could potentially keep you alive, known as life-sustaining treatment or life-prolonging treatment, such as a mechanical ventilator to help you breathe. In an advanced decision to refuse treatment, you can't refuse care to make you comfortable, keeping you warm, or request help to end your life. Just about that as well, when people do ask you about that, it's important to say that the other care will continue. Just because they refuse a specific treatment doesn't mean that all care and treatment stops. You'll still get that care that you need, that a person needs. Okay, next. Okay, so your doctor or nurse has to follow your advanced decision to refuse treatment as long as it's valid and applies to your current situation. So that's important. So in England and Wales, an advanced decision to refuse treatment is legally binding under the Mental Capacity Act. In Scotland and Northern Ireland, there isn't an active law, but it's likely to be considered legally binding by a court. Okay, next. So if you want to make an advanced decision to refuse treatment, in that booklet that we use, there is a form at the back of that can be completed. It's usually best done with your discussed with your GP and signed, preferably a witness as well. Yeah, you need to make sure the decision is written down, signed by a witness. And you need to share that with the health professionals that are involved in your care, and family and friends. Okay, just in Northern Ireland, this document can be placed on the key information system, which is on ECR. The GP would populate this, so you can do the summary of the person's advanced care planning, and then that's populated on. The reason for that is so that out of hours service can have access to that, to see also the Northern Ireland Ambulance Service will also have access to that. So it's important then that people know what the person's wishes are. It's important to say as well that advanced care planning, all parts don't have to be filled in. You can do one or two or three or four parts. You don't have to do them all. So, and it's you know, when people are making decisions like this, you know, we would encourage people to write them down, but it doesn't have to be. It can also be verbal and recorded. Okay, next. Okay, so briefly, oh yeah, a DNA or CPR decision. Well, I mean, a lot of people would ask about these things, and it has been on the news recently with COVID, where there's almost been blanket sort of DNRs placed in people, and it has caused a lot of anxiety. So basically what it is, it's a treatment that aims to start breathing and blood flow in people who have stopped breathing or whose heart has stopped beating. Some people decide they don't want to have CPR, and this might be because CPR isn't beneficial for everyone. It can cause serious implications. If you don't want to have it, you can tell your doctors or nurses. This is called do not attempt cardiopulmonary resuscitation decision. If you haven't made a DNR decision, or your doctor or nurse can make a decision on your behalf whether CPR is in your best interests. For more information on this, you can check, the special district nurses can check their RCN, and there is guidance around this, or the Resus Council, which has information as well. And remember, DNACPR is the responsibility of the person's senior clinician. Okay, next. So what happens if I can't make decisions for myself in the future? And again, some people lack mental capacity, which means they aren't able to make decisions. And again, because they're not conscious or they have a condition like dementia, it might be temporary, it might be long-term. If this happens, your healthcare team looking after you will still provide the care. And again, we'll try to follow your wishes that you're able to communicate or that you've communicated in the past. If a person did some advanced care planning, they'll try to follow the wishes that were discussed and recorded. And again, if they're not sure what you would want, they'll ask your family and friends. Healthcare professionals will involve your family or friends in decisions about your care, but they won't be asked to make decisions about your care unless they're legally appointed to do this. For example, if you've given them this power in your enduring power of attorney document, if you've made an advanced decision to refuse treatment, your healthcare professional will look at whether it is valid and whether it relates to your present situation. So that's really important. If this is the case, they will follow your advanced decision to refuse treatment. And again, if you've made a decision not to have CPR, your healthcare team will follow your wishes. If you haven't made a decision about this, your healthcare team may ask your friends and family about what you might want. This can help them make a decision in your best interests. Okay, next. So really just to summarize, what comes out of advanced care plans, you'll find that these are the main things that could come out. And as I said, not them all, so it could be one, it could be several of them, could be all of them. So a record of the wishes, a person's wishes, which there is a form in the back of the booklet. The advanced decision to refuse treatment, again, there's a form as well for that. Do not attempt cardiopulmonary resuscitation. Advanced care planning summary, that can be found on SharePoint, on the palliative care SharePoint within the Southern Trust. And again, that can be filled in by a healthcare professional. It needs to be given to the GP to populate. Organ donation, wills, enduring power of attorney, and funeral arrangements. And again, in times of COVID, it's important that we as health professionals are fully aware of some of the restrictions around some of these processes, especially funeral arrangements, organ donation, so that we are aware if anybody does ask us, or if we're not sure, we can come back to them on that, because there have been lots of changes and things are constantly changing. Okay, next. Regionally, the Heart of Living and Dying, engages members of the community and healthcare staff to discuss what's important to them now and in the future. It's a good platform for staff who will be having these conversations with the service users. So this was developed by Deirdre McKenna, the social worker in the Trust. And really, it's a really good way for staff to familiarise themselves. It's a process of them sort of looking at their own wishes, and it's sort of it's allowing people to wire into what's really happening in the community as well. You know, what people are thinking, so that we are also aware of our own mortality. So I would advise anybody, there's usually a global email that comes around for people to go on this here. I'm not sure what way it's happening now. I think it could be going online, but they're working on that. But it's really useful for staff to go on. Okay, next. So just the final wee quote there. Advanced care planning can make the difference between a future where a person makes their own decisions and a future where others do. So that's why it's so important. Okay, there's a wee bit of further reading there, and again, there's lots of stuff on advanced care planning from Marie Curie, Macmillan, Compassion in Dying. There's lots of websites, lots of information. This has really just been a taster almost. It can be quite complicated, but we try to keep it as simple as it can. Good luck, and I hope this has been helpful. So we're going to take a few questions now, I think. Thank you.